Governor, I know you said you wanted to clarify your remarks about shopping across the line. I just want to double check, though, and I know you don't want people bending the rules, but so are you now saying they don't have to quarantine and should just use common sense?
Yeah, so hello?
Yes, hello.
Okay, sorry, the lights were blinking. Yeah, so look, what I said was, first of all, I would prefer everyone shops in Rhode Island because it helps the Rhode Island economy. But secondly, I understand that there are some people who live very close to, much closer to a store in Massachusetts for groceries. So, if that's the place that you feel it's safer for you to go, wear your mask, wash your hands, and just go right home when you're done. So you're not quarantined for 14 days, but you still have to obey the stay-at-home order. So after you do your grocery shopping, go home.
Okay, thank you.
Other questions?
Governor, yes, I had a question about nursing homes. This is Amanda Milkovich. I've been hearing that there's going to be a move, or there is a move to either consolidate some of the COVID-19 patients in one facility. Is that actually happening?
Yeah, we're thinking about it, yes. That's the direction that we want to move in, yes.
Okay, so sorry to jump in again. I've heard that patients who are leaving the hospital who are COVID positive are being sent to Oak Hill. Is that correct?
Oak Hill can receive patients, yes, as with others. And because they have a higher percentage of patients who are COVID positive, they have the experience to be able to receive patients being discharged from hospitals as well.
But they're not the only one?
We are looking to limit the number of nursing home facilities that COVID-positive patients go to. We really want it to be a place that is able to appropriately care for those patients and keep them cohorted with others.
Which nursing homes?
Oak Hill thus far is one that is doing that. We are looking to work with other nursing homes as well.
We've been hearing... This is Liz Goodwin from the Boston Globe. I was wondering, President Trump yesterday made it clear that he doesn't really see much of a federal role for testing going forward. And I guess I'm just wondering, when you think about 3 weeks in the future, when you're lifting social distancing a little bit, how important is federal support on testing and other matters to make that successful?
It's very important. I don't know how to answer that. The reason we're in this mess is that we as a nation have not invested appropriately in our public health infrastructure. And so as a result of that, we now have a public health problem and an economic crisis. So while it is certainly true that every governor has to be working for the people of our state and buying directly from the private market medical device companies, which we are doing, all of us, there's absolutely a role for the federal government. For instance, there's the IRR, which is a federal government entity, which is purchasing a lot of the testing kits in the private market and then distributing those to the states. So that is a vital part of our infrastructure, and we need to continue to be able to tap into that.
We have the details on the nursing home deaths, please.
Yes. The unfortunate deaths that were announced today are from 3 nursing homes: Orchard View, Oak Hill, and Golden Crest. You can let me know if you'd like to hear total numbers.
Yes, please. Yes.
So places with significant numbers of unfortunate fatalities include 23 deaths at Golden Crest, 17 total deaths at Oak Hill, 10 total deaths at Orchard View Manor, and 4 total deaths at Oakland Grove. There have been a total of 66 deaths at nursing homes and 69 deaths within all congregate settings. One thing I will add to this, especially imagining how challenging this is for nursing home and other congregate settings, is the nursing homes have mentioned the additional layer of challenge to respond to you all from the media standpoint. And the ability or the ability you all have to be able to work with us to get some of the nursing home questions answered so you have the information you need, and to minimize how much you are putting the burden on them as the nursing home facilities to answer those questions is something we want to work with you on, just to allow them to handle the very challenging situation that's going on, particularly given the number of unfortunate fatalities that have occurred.
Were the 3 homes that accounted for the 6, were they equally spread between the 3?
There were 1 at Oak Hill, 2 from Golden Crest, and 3 from Orchard View.
Thank you.
Doctor, can you break down the number of people who are on the patients who are on ventilators right now, and the number who have come off and are now classified as recovered or have been sent to a nursing home or other rehab facility?
So we have 229 current hospitalizations. 54 people are in ICUs, and 44 of those people are intubated and on a ventilator. In terms of those who have been discharged, the number that have gone to nursing homes versus other facilities is something that we are still accumulating, but I would certainly say we rarely send someone who is still COVID positive back to a nursing home facility. That's against one of, it's one of the many aggressive measures we've taken. We've really wanted to be clear with 2 negative tests prior to sending anyone from a hospital back to a nursing home facility.
And that includes healthcare providers and patients?
What'd you say?
That includes both healthcare providers and patients at those nursing homes?
Yes.
So sorry, Dr. Alexander Scott, just to clarify what you said before, though, that wasn't Oak Hill accepting COVID-positive patients from hospitals?
Yeah, except for Oak Hill. So I said it's rare.
Okay.
For that.
And could you just explain the rationale behind a facility like that? People are going to hear they've had a lot of deaths. They're going to think that that's not a great place for somebody to go. Could you just explain the thought process there?
Yeah, we want to make sure that the few facilities that are able to accept people who are COVID positive have the experience and capability to do that. Places like Oak Hill and others that we are initiating conversations with will be able to have the enhanced support needed. The unfortunate deaths are not specifically limited to a particular facility. It's really a reflection of the number of cases that has occurred in a medically and physically fragile population, with the known data that people who are seniors or have underlying illnesses are at higher risk of this unfortunate outcome. So the numbers that we are seeing are what would be expected for knowing there can be increased cases in these congregate settings, particularly nursing homes.
So I just want to make sure I understand, when you talk about the Oak Hill deaths, are those some of the people who are dying at Oak Hill may have come from other nursing homes and then are accepted to Oak Hill and are counted as part of that population?
No.
Okay.
These were people who were residents at their respective facilities.
I got it. So when they're discharged from the hospital, they're not going back to their old nursing home. They're going to Oak Hill because Oak Hill is more likely is one of the facilities that's set up to accept them. Is that correct?
And that's going forward.
Going forward, starting today or this week? Okay.
Correct.
Okay.
And none of the deaths at any nursing home has been someone who was discharged from a hospital?
I would have to get back to you on that specifically.
Thank you.
They may have been discharged for non-COVID reasons.
Yeah.
Okay. Doctor, you said 69 deaths at congregate settings, 66 are nursing homes. We know that 2 are group homes. What is that last one? Do you know?
A psychiatric setting.
Okay, thank you.
Repeat that again. It broke up.
A psychiatric setting.
Thank you.
Governor or doctor, I don't know who can answer this, but in terms of the CVS testing site, this new opportunity for healthcare workers in congregate care settings to get tested, are those people still going to have to be exhibiting symptoms, or is that going to be open now to asymptomatic congregate care healthcare workers?
I'm glad you asked. Symptoms is the primary approach that we are taking, but in specific situations with the nursing homes, because we are doing an aggressive infection control and testing surveillance strategy, there are situations where we are working with nursing homes to have staff get the testing at CVS, even if they do not have symptoms but are caring for patients who do. So it's a combination of both under our specific guidance.
Governor, I have a question about your executive order on cloth-based coverings. I have a viewer who has pointed out to me that even though you've said it, and it's also on Commerce's website, that manufacturers is not specifically in the language in that executive order. I just wanted to know if you could clarify that manufacturers are a part of that executive order.
Yeah, thank you. So in the list, there's an other category. And
correct.
And DBI and manufacturers is in the other category, and I have said it, and we have been in touch with the Rhode Island Manufacturers Association, so they're aware of it. But DBR, Department of Business Regulation, is putting out, clarifying regulations, and so I'll make sure to be clear that manufacturing is included. Another part of the other is also construction workers, so that's not specifically enumerated, but construction workers also fall into that, and we're going to continue to clarify that through DBR.
Thank you. And this is Alexandra from Channel 12. I also just had a quick follow-up. I chatted with RIMA earlier this week about their pledge from manufacturers. They're trying to get all manufacturers on board with safety guidelines. They have that pledge due by April 30th. Just wanted to know if you were aware of that.
Yeah, I am aware of it. I'm extremely supportive. I'm very grateful for their leadership and hope that other industries follow their lead. That's the way this is going to have to work going forward. It's going to be like industry by industry regulations and a set of new normal that, I will enforce through the normal mechanisms of state government. But frankly, the private sector has a role to play too. Industry associations are going to have to support it. There'll be a certain amount of peer pressure, for a lack of a better term, and I think it's great that everyone signs a pledge and RIMA helps to enforce it within an industry.
Last question.
You teased that tomorrow you would be releasing some of the modeling data. Can you give us an idea of what type of data it is you'll be releasing tomorrow? Will it, be predicting a peak, predicting when restrictions could end, stuff like that?
Exactly, Paul. It'll be, a lot of people are wondering how bad is it going to get, when's it going to get very bad. I have been very clear that these models are only as good as the assumptions, and the assumptions are tough to pin down. But yeah, it'll be an effort to show what our best estimates are at this point as to the shape of the curve.
Okay.
All right. Thank you, everyone.
Thank you.
We'll be back tomorrow.